It's in times of crisis that we find out who we really are.
I've felt broken on many occasions.
This guy's not going to survive the night. Yeah. We'll have to call the family, I think.
I just sat on a chair and just held his hand.
It's trauma. It's trauma on every level.
Yeah, okay, ready, steady, go.
This is the story of one hospital and one community in the time of coronavirus.
Every single person on the front line now has to deal with their own trauma.
It's about people, their grieving, their goodness.
You just have to keep strong. I always tell myself someone has got to treat people.
Their strength and their humanity.
Everything's okay. You're at the Royal London Hospital. London.
Don't be fooled by the gentle pace. Time is twisted here. On the Royal London Hospital's coronavirus wards, while many patients inhabit ventilated worlds of slow-motion dreams and hallucinations, the doctors and nurses charged with bringing them back to life inhabit the real world, where time moves too quickly as this cruel disease eats away at human lungs with frightening speed.
Can we just do a couple more suctions?
But the medical staff, including consultant PJ Zolfagari, have their own nightmares.
The number of patients that arrived in that short space of time completely overwhelmed the entire team here. They are an exceptional group of patients that are unwell, I guess. And the amount of work required around the clock to keep the ventilators running, to keep their oxygen levels up, to keep 24 hours nursing care. And it's not unusual when at the height of the surge that we had to find people sitting in a corner and a few tears being shed.
Then, as our interview ends, he's called away.
I'll be 2 minutes.
His 2 minutes turn into several agonizing hours.
You see, you're working hard to ventilate, aren't you?
We had permission from all the patients or their families to film.
Do we have any more atracurium?
And Krishna Pillai Yogan's vital signs have worsened.
It was 5 mils. Yeah.
He's just 55.
Yeah. And again, yeah, go.
The professionalism of the team is stunning. Years of experience are gathered around this bed. As the duality of time, the drifting oblivious patient, and the rush to save his life merge into a tableau for our times.
Okay, this doesn't look good.
How concerned are you?
I'm extremely concerned about this chap, especially at this late stage as well, that he's developed further complications.
So there's a final roll of the dice.
So you guys lift him up, I'll push the pillows down, yeah?
Ready? Go. This is a last resort. Maybe by turning him onto his front, they can force air into his lungs, oxygen into his body. It's all they can do.
Yeah, okay, ready, steady, go. His lungs are just getting worse and more inflamed again.
And you've been preparing to talk to his family?
Yes, that's right.
So just to let you know, have you called the family yet?
Senior Sister Becky Smith, a presence on the COVID ward for absent relatives.
Okay. All right, lovely. Thanks, Gavin.
Their eyes and ears.
Potentially we'll make a decision about whether it's appropriate to continue with what we're doing at the moment or whether we should give him a bit of dignity.
Imagine this stress for the team multiplied every day for weeks. Now you understand what the peak of this pandemic was like.
You all right?
Face is all marked.
Well, you've just come off shift.
Sister Carleen Kelly bore witness to those dark days.
I've felt broken on many occasions, and I think a lot of my colleagues have. It consumes you. It's what you think about when you go to bed. It's what you wake up. You're preparing for your next shift. You're relieved that the previous shift is over. You're sad. It's huge. It's a huge emotional burden.
Every single person on the front line now has to deal with their own trauma, has to go home, has to process this, and has to come back And you're asking a lot of people to walk into a hospital full of a deadly disease, to do their best every single day, to change their entire work style around it, put their family second for this, for I don't know how long.
No, my friend's in my pocket.
The peak almost broke minds, and according to consultant Nick Bunker, almost broke the Royal London.
In normal times, we manage about 44 patients. At the peak, we were managing just shy of 90 patients.
So almost double.
Almost double. We were 20 beds away from being overrun. We were keeping people alive. That's what our goal of care was. Keep as many people alive as long as we can until we can get back to being able to deliver the quality of care that we always aspire to deliver.
No one here cares to visit those dark days again, but the destiny of this intensive care unit isn't in the rubber-gloved hands of the doctors and nurses themselves. It's in the hands of government ministers and the public.
Are you expecting a second wave?
Yes, I mean, I have to say yes, because I think once the lockdown is relaxed, people, of course, are going to have more contact with each other. So that's the way this is going to spread. But if the lockdown completely disappears, then I suspect that the cases will just rapidly rise again. You know, we've learned a lot during this last few weeks or last couple of months. Not perfect, but, you know, I think we're better placed for it now.
Sometimes it's hard to find light in the darkness. But you're about to witness what medicine can do.
I'm going to take out your tube now.
This is one of the defining moments in an intensive care unit.
Give me a big cough, big cough. That's it. That's it.
When a patient's ventilator tube is removed. It's a procedure full of expectation and dread.
And we'll pull out the tube as we do that, okay?
Will it work?
Nice big cough again.
He's grimacing as the tube inches up his throat. And finally leaves his chest.
Everything's okay. You're at the Royal London Hospital.
The heavy breathing of a man given a second chance.
It's a victory for everyone, a morale boost for everyone as well. Now, as I said, he's still not out of the woods, but at least he's doing good, and we're very, very pleased to where he's got him.
It's hard to comprehend how historic these times are when you're living them. Only distance will aid clarity. With the lives and jobs lost because of coronavirus, destined to become chapter headings, not footnotes, in the public record. And in one corner of the East End, the work of a tiny morgue will become part of London's narrative. All communities here have been hit by the coronavirus. But this place, up and running in a matter of days, serves the desperate burial needs of the Asian community. Hit hardest by the disease.
At the height, we were dealing with around 25 bodies daily coming into the morgue because the cemeteries and other funeral services weren't able to cope.
The leadership of the East London Mosque felt it had a duty to intervene when Muslim dead began to pile up.
It's beyond really comprehension. You know, people would have this guilt inside the family and the community that we couldn't do the right thing for our deceased, especially the ones that suddenly passed away. You know, so it would have been a guilt that would have been felt throughout our lives, you know. This lady phoned us up in the mosque and said, well, look, I've got my dad who died, passed away in the hospital. My mum is quarantined in my home. I can't see her because I have to be away from her, and I can't see my dad before he is buried. This is the kind of situation that we had. And it brings tears to my eyes now, even now talking about it. This is how bad it was. You know, people felt so helpless.
It's often when we feel helpless that some turn to faith. While the Royal London may be one of the leading teaching hospitals in the world, there's always a little corner for what's important. The Muslim chaplain here, Imam Farouk Siddiqui, is proud of the Royal London's links to one of the biggest Muslim communities in Britain. He's on his way to see a patient who survived COVID-19, but whose underlying health conditions were complicated by the disease. She gave us permission to film. She doesn't have much time, and she's refused any final medical intervention at the end to save her life. A balm for the dying. Farouk's had to recite these words so many times in this pandemic.
There was too many people to bury, and we had some cemeteries where they were having a kind of an Islamic version of a mass graves, where they would bury 10 people in one kind of plot. It's gripped into the heart of our community which is based around the mosque, family relations, being with friends and loved ones on a daily basis.
Death appears, again, 2 floors above, on the coronavirus wards.
It's been a difficult night for the team here. They lost 4 patients, every one a tragedy, and at the height of the pandemic, on one night 11 people died. Now this is one of the vacant, empty beds left behind.
We'd already spoken to senior sister Becky Smith about the possibility one of her patients was nearing the end.
Potentially we'll make a decision about whether it's appropriate to continue with what we're doing at the moment or whether we should give him a bit of dignity.
Krishna Pillai Yogan was in his mid-50s, and the decision was made to stop his life-saving drugs. A white partition was placed around his bed, and Becky's face was the last one he saw.
Take us into the cubicle at that moment.
I just sat on a chair and just held his hand to be with him in that time. It was a very quick experience in that way. We give the patient a full wash together, so 2 nurses will always give them a warm wash, put them in some new clothes so that they can be sent away with a lot of dignity and respect for their body and for their life.
Do you take any of this home?
I think in these current times with COVID, it's a lot harder to separate things because you feel like it could be your dad, it could be your mum, because it's so close to home for everybody in the world at the moment. It's difficult because it's happening every day. So you do definitely take it home.
We'd all like to leave behind more than an empty bed. For the shadow we cast to be benign. Those who chronicle this time of coronavirus will record that this hospital and the community it served tried to work together to leave a legacy of which both could be proud. But there are some prouder than others, and rightly so.
I love my job. Yes.
Because in normal times, their contribution to our lives is mostly ignored.
We clean to reduce the infection, so if I don't come, the infection is going to spread more.
You see, the front line of the war on coronavirus is everywhere. The trenches are in the mundane, on the floor of a corridor, on a door handle, in the shake of another's hand. Damour Asari is proud he's waging war on the virus, a 10-year veteran of the cleaning staff at the Royal London Hospital. He's at work as London wakes and blackbirds sing.
All of us cannot be doctors. Somebody have to be a doctor, one have to be a nurse, and somebody have to be a domestic. So I'm proud of what I am.
It's a selflessness much admired in this pandemic, those choosing to do what others wouldn't. And so many of the nurses and doctors and consultants, as well as cleaners, the helping hands guiding us through this storm, are black, Asian, and minority ethnic. Somewhere deep down, my heart skipped a little, entering the Royal London Hospital's COVID wards. Because studies suggest those from the BAME community are being affected by the virus disproportionately, and are almost twice as likely to die from infection than those who are white. Why is unclear.
There's no obvious pneumothorax. Great.
When it comes to BAME NHS staff, proximity to the virus through close contact with infected patients is a disproportionate feature of many of their roles in the health service. Some argue the NHS needs to examine staff deployment policies for structural racism, where certain workers are retained in lower paid roles. But for most nurses and doctors, white or black, given the correct protection, where else would you want to be if not cushioning a patient's pain? Because when all the fancy labels are stripped away, your job
How are you feeling?
is to care. Listen to Irene from Uganda, a nursing student who we filmed on her very first day on a COVID ward. She has the perpetual anxiety of every single nurse or doctor, no matter how experienced, working in that environment with the virus so close.
You're like, oh my God, was I careful enough? Am I getting it today? Will I get it tomorrow? It's very real, yeah. But you just have to keep strong. I always tell myself someone has got to treat people. Like, I mean, even if it were my relatives, I would want someone to care for them. So that kind of keeps me going.
Does the virus know a victim is black or white? Of course not. But socioeconomic factors like income and wealth and education affect the quality of the health of all of us. As such, poorer black and ethnic minority communities may be more vulnerable. But there are other tragedies lurking in this pandemic. For some who've proudly called this country home, but whose hearts belong to a foreign field. In this morgue, we came across two bodies, two women. One from West Africa and one from North Africa. They called Britain home, but now there's a purgatory, a final torment. Because one of the COVID victims wanted burial in the soil of her birth. But the closed border means her body sat here for 2 months. In this mosque, two more bodies, shielded by the flags of Turkey and Northern Cyprus. And there are more bodies outside, piling up in shipping containers.
I'm waiting for it to hit me. At the moment, I can't afford to break down. It's painful. It's painful. It's too personal, it's close, you know, it doesn't get any closer when you're growing up in your community and then you find yourself having to do the last journey for him, understanding the pain that the families are going through. It's trauma. It's trauma on every level. Painful.
Grieving delayed is grieving denied. But the shattering loss for so many in this pandemic is leavened a little by the fact that the staff at the Royal London did everything they could to save lives, that the dead were given the best possible chance of life. The National Health Service, to which the Royal London belongs, is now enjoying a renaissance in public acclaim because so many lives have been saved in this pandemic. And throughout the strictest days of the lockdown across the UK, once a week, millions around the country took to the streets to show their appreciation, joining hands in solidarity and gratitude. But longer term, while there's no cure or vaccine for the coronavirus, can the NHS, often strapped for cash, maintain the highest of standards? Can the service adapt to a new normal way of working with a virus that could be here to stay? It was for 10 days that we were given unprecedented access to the Royal London Hospital. And in that time, we caught a fleeting glimpse of the enormous challenges of managing a deadly disease. The roller coaster of emotions and the thin line between life and death.
Yeah, go.
We watched the agonizing attempt to save Krishna Pillai Yogan.
Okay.
But what of the man himself, whose life ended on that COVID ward? A man we didn't know. We wanted our memory of him not to be of tubes and ventilators, but of the full life he'd led and the people he loved. He was the proud father of 4 sons, including Nith, here on his graduation day. He wanted to speak to us about his dad.
Hi.
I only got married last year, so it's been 1 year and a bit. So that I guess that was again who none of us would have thought this time last year in all that kind of happiness something like this would have happened actually. So it is a bit of a shock and it is hard to swallow actually. You have to try and move on. I think that's going to be the hardest thing for the first few weeks, months. Obviously we're not even able to see each other as a family at the moment, so we're in kind of 2 separate houses, which is quite tough. He was only 2.5 weeks shy of his 56th birthday actually, so he didn't even make it to that.
However, for Trevor Smith, there is another summer. His 65th. His voice box is no longer silent. For weeks, his life hung from a plastic tube inserted into his throat to provide the supply of oxygen his body needed that COVID-19 had choked off.
Yeah, many times I thought I would die. Especially when you get the breathing, you can't breathe properly. I had many thoughts of even, trying to kill myself. It was actually coming to that bad decision I had to make. Because my sickness was not going to go anywhere. So I had to do something to relieve the burden of my wife and son.
Trevor survived after being in the deepest and darkest of places. Now, the sun is shining. For veteran consultant trauma surgeon Martin Griffiths, it's the humanity of the NHS in this pandemic that's now attracting scores of new recruits.
People are running towards it. The medical students are running towards hospital to become healthcare support workers and become doctors, start their training early. We're having to turn people down who want to commit to support the effort. And there is kindness everywhere.
The NHS is thriving for now. There are even 2 new gleaming floors at the Royal London for possible COVID patients. But what about cancer screening or heart disease? Many who are sick in the community have stayed away, worried they might catch the virus.
Hello, sir. Good morning.
Experienced intensive care consultant Nick Bunker wants them back.
All the people who would normally have presented here with ailments, where are they?
I suspect some of them have died. Some of them are at home. For cancer, we've not been doing a lot of diagnostics. So if you're not doing the diagnostics, you don't pick up the early cancer with the few symptoms that people have early on. And so perhaps we're just not detecting it. It's still out there.
The fervent hope as the lockdown eases is that people will drift back to the NHS for whatever hurts them, and the service will be able to help everyone, if we help ourselves.
There are friends and there are colleagues who we know who are dying and are sick. People I care about have been lost to coronavirus. You can't overstate how simple measures are having a huge effect. I know it's boring, I know it's challenging, but look at it from my perspective. I don't need to see any more dead people.
Whatever happens, the commitment of the men and women we came across at the Royal London won't transform, because this is personal.
Sitting in your car going to work, and when you think to yourself, am I Is this what I want to do with my life? And the answer is yes, absolutely. This is the one time I need to stand up and do my job. This is the one time I absolutely have to be there.
But when can we leave this pandemic behind and return to normality? When can our collective mourning begin? All the deaths have so far been wrapped up in charts and graphs. Over 40,000 are dead. But this pandemic isn't about numbers. It's about people, their grieving, their goodness, their strength, and their humanity.